Okay, students. So we have seen the definitions like of small volume and large volume parenteral. So any formulation which falls 100 ml and below 100 ml falls under small volume parenterals. It may be ampules, syringes, vials, cartridges, and all. Right. Above that, they are large volume parenterals. And we have also seen the introduction, definition, types of the products we have seen in the last class. And first, we have also seen basic characteristics of the small volume parenterals, right? We have seen that all the formulation should be sterile, free from the pyrogens, and free from particulate matter. These three are the important characteristics for the small volume parenterals. We have also seen the advantages. I hope you remember: quick onset of action, suitable for the drugs which are not administered by the oral route, useful for unconscious and vomiting patients in emergency situations, and etc. We have also seen the limitations of small volume parenterals. Then we have also seen routes of administration of small volume parenterals. Right, there are different routes of administration in small volume parenterals. Like you can give it through subcutaneous route, intramuscular route, intravenous route, intra-arterial, intrathecal, intraperitoneal, intracardial, intrapleural, intradermal, and goes on. The list goes on, right? Then we have seen also formulation. In formulation, we have seen about vehicles, two types of vehicles: aqueous vehicles and non-aqueous vehicles. In aqueous vehicles, we have four types: water for injection, sterile water for injection, bacteriostatic water for injection, and one not given here: bacteriostatic sterile water for injection. So ultimately, water for injection is that formulation which basically doesn't have, or the formulation or the water which is free from pyrogens and suitable for being to being used as a vehicle in the parenterals is generally called as water for injection. Then coming to non-aqueous vehicles, commonly non-aqueous vehicles are used when the drug is basically uh, not suitable with, if given with water, maybe hydrophobic drugs, or they can be the readily oxidizing drugs, or some drugs with whose stability is less. We generally use non-aqueous vehicles. Like there are a lot of vegetable oils here: peanut oil, corn oil, cottonseed oil, sesame oil, right? Then soybean oil. Sometimes you can use ethyl oleate and isopropyl myristate. All these falls under non-aqueous vehicles. We also see the other additives like antibacterial agents, which we are going to use, buffers, tonicity adjusters, surfactants, chelating agents, and inert gases. So these are the different formulae. These are different additives which we are going to use in small volume parenterals. We have seen each and everything with lots of examples also. Right. Then we are also seeing general procedure of parental preparations. So what is will be the general procedure of parental preparation? Cleaning of the containers, enclosures, and equipment. So they should be free from particulate matter. They should be free from pyrogens, right? So you should clean all the containers, enclosures, and equipment. And collection of raw material is one of the important part. Preparation of parental products, filtration. Filtration is very important because you cannot remove the pyrogens from simply heat sterilization or autoclaving or something else, because pyrogens are not living, they are basically bacterial endotoxins. So you need to filter them through bacterial proof filters or membrane filters. So filtration is a very important step. And filling and preparation in final container, sealing the container, sterilization, especially terminal sterilization, and evaluation of parental preparations. What kind of evaluation we do before labeling? We will check for leakage stage, we will check for presence of particulate matter, right? Then we will go for the pyrogen testing, and we will go for the sterility testing. I hope you remember we have already discussed in detail about all this quality control test and evaluation test of parenterals in previous class. Then coming to manufacturing of small volume parenterals, we haven't discussed in last class. We will see it today. In formulation, we have seen that we use vehicles, aqueous and non-aqueous vehicles. Then we use buffers, we use tonicity adjusters, we use surfactants, we use wetting agents, and we use chemical stabilizers, etc. In coming to manufacturing, maintaining an exceptional clean area with low bioburden is very important, as we discussed earlier also, right? Formulation in aseptic way is very important for the small volume parenterals. Keeping equipments ultra clean, keeping raw material at lowest bioburden, and high level of cleanliness must be imposed to minimize the risk of product concentration by pyrogen substances. So Then you have sterilization, high efficiency particulate air filters, right? That is HEPA filters should be used, and laminar airflow should be used to to maintain the sterilization activities. Then membraner microfiltration is especially used for filtering of solutions in order to get rid them from pyrogens and other kind of bacteria. Then manufacturing of products, the majority of the formulation fall into three pharmaceutical product categories, that is parenteral solutions, parenteral suspensions, and parenteral solids for reconstitution, right? Like we have reconstitutable syrups, dry syrups, we have the dry parenterals also. Basically many antibiotics like penicillin or their derivatives and other antibiotics whose stability is very low, we generally prepare them as in solids for reconstitutable injections. So we will take that those powdered formulation, we will mix them with the water for injection, we will shake them, we will make sure that no particulate matter is present there. Then we will take this suspension into the syringe and we will give it to the particular patient. So manufacturing as a solution, as a suspension, and even as a solid reconstitutable parenteral are available in manufacturing. So preparation of small volume parenterals, what are the important things as we discussed? I hope you remember, right? We basically first try to maintain the osmotic pressure, right? So osmotic pressure adjusters such as sodium chloride and mannitol are generally used. Then we use bacteriostatic agents. These are required for multiple dose containers, we use benzyl alcohol here, right? Benzyl alcohol commonly used in injectables. Then we use buffering agents, pH adjusters, and chelating agents. So buffering agents such as phosphates, acetates, and citrate salts are generally used to prepare these buffers, and the choice of which system to use is determined by the desired pH and compatibility of the active ingredients with the buffer systems. Then pH adjusters such as sodium hydroxide or HCl can be used in combination with suitable buffering agents. Occasionally, the pH can be adjusted with additional buffering agents. Then chelating agents, generally EDTA is used as a chelating agent here. Then coming to operations, non-sterile formulations, sterilization, then sterile subdivision is there. You can see clearly in this flow chart. I'll try to show you with the marker how the formulation is done. Guys, check it carefully. See, what's going to happen. So you can see first non-sterile formulation, you will take water for injection here, and then you will heat it at 120 degrees centigrade for 20 minutes. Then you will cool it down back to 60 degrees centigrade. Okay, now this water for injection is taken, and basically it's made into two parts, and in one part you are basically going to mix the other excipients like addition of sodium phosphate, monobasic sodium phosphate, and dibasic sodium phosphate, right? We will add excipients, then we will cool it down to 25 to 30 degrees centigrade. Now we will add active pharmaceutical ingredient, because we don't add the drug at 60 degrees and 120 degrees because thermal decomposition can occur. So we will let it cool down in aseptic conditions and sterile conditions. Then when it comes to nearly room temperature to 25 to 30 degrees centigrade, we are going to mix drug and preservatives. Then after mixing of drug and preservatives in this part of water for injection, we will adjust the pH and check the pH to make it to the 6.8 to the 7 range. That is slightly like weak basic to neutral range. Then you will adjust the volume by adding the remaining part of water for injection. So this is the flow chart for the preparation of non-sterile formulation. Students, I hope you are getting. Please check it down. What's happening? You're taking water for injection, then you are heating it at 120 degrees centigrade for 20 minutes, then you are letting it to cool down. So after cooling it, that is bringing it below 60 degrees centigrade, you are divided into two parts. One part is used after formulation, right, after mixing to make up the volume. In other part, you will add sodium phosphate, monobasic sodium phosphate, dibasic sodium phosphate. Then you will cool it down further to the room temperature, that is nearly 25 to 30 degrees centigrade. Then you will add drug, preservatives, and you will check the volume, check the pH, and you will manage it to the 6.8 to 7.0. Then you will adjust the remaining volume with the remaining part of water for injection. Then sterility step. in that what happens basically now, this formulation is basically sterilized using zero point 0.2 micrometer membrane filters. You can clearly see it, right? Then then that particular formulation is collected in sterility tank. You can see here I'm marking, showing you clearly, right, what's happening here. Right, from here, that is after making up the volume with the water for injection, after addition of drug, preservatives, checking the pH, adding the buffer, tonicity adjusters, and every excipient in it, whatever we have discussed earlier. Then we will go for the sterility test. In sterility step, sterile filtration step, basically we will filter it through 0.2 micrometer membrane filters. Then we will send it to the sterile collection tank, or right. Then after that, after sterile filtration, we will go for the aseptic subdivision and we will pack and seal the bottle. So this is the schematic representation and flow chart of preparation of or manufacturing of the small volume parenterals. I request students to take the screenshot of this flow chart and draw it in your notes after the class. Okay. So take a screenshot, everybody. Yes? Can I change the slide? Yes, guys?
Yes, sir.
Right. So preparation of typical suspension formulations. As we discussed, three types of formulations are there. Non-sterile formulations, I mean solutions, suspensions, solid reconstitutable suspensions, right? Or solid reconstitutable parenterals. So now we will see about how suspension formulation of small volume parenterals are prepared. So sterile suspensions for injections are more complicated in composition than the sterile solutions. Usually, portion of the suspension compositions are prepared and sterilized separately. First suspension is prepared, then it is sterilized separately. Later, these portions are combined aseptically to yield a final sterile bulk product for aseptic subdivision. So this is how it is sterile suspensions for injections used, prepared. What operations are there? Preparation of saturated sodium chloride and drug paste, sodium carboxymethyl cellulose, sodium CMC is used, then polysorbitol 80 solution is added, then sterile water injection is added, and preservative solution is prepared. You can clearly see in the schematic representation of how parenteral suspensions are prepared. You can see drug is taken and size reduction, milling is done. I hope you know we always do this thing to get the uniform size and size reduce it manually in the preparation of suspension. So you take drug, you will take it in mortar and pestle or any equipment which is generally used in subdivision or generally used in size reduction. Then you are reducing the size, right? So first part. Second part, you will take water for injection. You will heat it for 120 degrees centigrade for 20 minutes. Then you will add sodium chloride and you will mix in it. Then you will keep it in autoclave. So you can see the one component contains drug and sodium chloride and water for injection kept in autoclave. Then you will take water for injection, heat it for 180 degrees centigrade, add sodium CMC, carboxymethyl cellulose, which generally acts as a suspending agent here, right? Then you will filter it, clarify it, right? In order to remove all the insoluble particles, you will keep it in the autoclave. Then you will take third excipient, third part of water for injection, heat it at 180 degrees centigrade, add polysorbate 80, right? Polysorbate 80 here is a surfactant and wetting agent. Then that third part is also kept in autoclave. Then you will take water for injection, heat it for 180 degrees centigrade, and so this water for injection, you are not mixing anything here. This is solely we are using to make up the volume, and you will keep in the autoclave. So you can see in autoclave we have drug with a water for injection, sodium chloride here is tonicity adjuster with water for injection. Then we have sodium CMC. This is generally used as a suspending agent here with water for injection. Then we have polysorbate 80, which is generally used as a surfactant and wetting agent here with water for injection. Then we have the plain water for injection here. Then you will autoclave it. After autoclaving, what can you do? Now you will add this all second part, third part, fourth part, and fifth part into the first part. That is the part which contains water for injection and the drug and tonicity adjuster, sodium chloride. You will add in it sodium CMC with the with water for injection, right? Then wetting agent with water for injection and all other things, right? And you can clearly see the order of mixing here, right? So first what you will add, then what you will add, right? So one by one, first you will add this thing, right? Polysorbate 80 with the water for injection. Then you will add sodium CMC, right? Then third, then you will add this thing, plain water for injection, right? Then you will add the preservative at last. So after adding all these things, you will subject it to the homogenization. You will subject it to the homogenization. With homogenization, all them will be uniformly suspended in the liquid vehicle, that is water for injection. So now you have a suspending agent here, that is sodium CMC. Then you have preservatives in this formulation. You have a wetting agent, surfactant here, and you also have a tonicity adjuster in this formulation, right? If depending on the requirement, if you want to add any buffering agent, if it required, you will add it. So except that, nothing is missing. Then you will go for the filling station. You will filter them with the bacterial proof filter, and everything is done in aseptic way. You can see this division. After this division, everything is done in the laminar flow, you can say, and high efficiency particulate filters, and this is completely aseptic route. So everything starting from mixing, homogenization, sterile filtration through zero point 0.2 micrometer membrane filters, then filling, packing, sealing, everything is done in aseptic side, right? So this is the schematic representation of how parenteral suspensions are prepared. I request students to take the screenshot of this slide, please. If done, let me know. Done?
Okay, sir.
Yeah, very good. So you can see in autoclave step how we are going to autoclave. So the paste means all that sodium CMC, right? That is suspending agent, water for injection, drug, everything will be there, right? So you will keep it there, right? You will pack like this, right? Through filter vent, it is filtered, and through that zero point 0.2 zero point 0.2 micrometer membrane filter, and this is autoclave. So thermocouple is there, stainless steel valve is there, right? Everything is there. So this is the setup how you will keep in autoclave, right? And preparation of typical freeze dried powdered formulation, very important, guys, because we said there are three different type of manufacturing. One is manufacturing of parenteral solutions, then manufacturing of parenteral suspensions, then manufacturing of powders, reconstitutable powders, right? So how they are prepared, these are basically prepared by the freeze drying method. So this is also called as lyophilization. Freeze drying or lyophilization is a drying process applicable to the manufacturing of some products. Reduction of heat input during drying and avoidance of prolonged solution of the drug in the liquid solvent during the solvent removal phase is done. Freezing by one of the following process: freezing on refrigerated shelves of the lyophilization chamber is done. Operation, what different things are done here? Here lyophilization chamber setups and sterilization is done. Non-sterile solution is formed. Solution is filtered. Aseptic subdivision is done, and then lyophilization is done. So this is the schematic representation of how lyophilization is done. I hope you remember in we from second year in pharmaceutical engineering we have already studied how freeze dryers will work. I hope you remember. So those substances which are thermolayable, which can be destroyed and deteriorated and degraded when temperature is increased and dried. So for those substances, we can go for freeze drying method. So in freeze drying method, this is also called as lyophilization. Here basically water is sublimated, right? That is, we don't go for drying step by heating, but instead we'll go for cooling, and triple point temperature is generally is used here to attain this lyophilization, right? So water for injection is taken, then it is heated for 120 degrees centigrade for 20 minutes, then again it's cooled below the 30 degrees. I hope you remember. Then you divide it into two parts, right? You can see here, first you have taken water for injection, you are heated it for 20 minutes at 120 degrees centigrade, cooled it, brought it to the room temperature, divided into two parts. One part is kept to maintain it, to use it for making up the volume, and you are taking the second part and you are adding all other things like drug, preservative. Then you will check the pH, you will mix them both, right? Then you will solution the you will filter the formulation through bacterial proof filter, right? The sterilization step will be there, right? In bacterial proof filter, what we will do generally, we will take zero point 0.2 micrometer membrane filter and filter it in order to remove all the pyrogens and all other particulate matter and all. Then in aseptic subdivision, you will mix them all properly, right? And you will subject it to the lyophilization. So same as the solution preparation, but lyophilization step was being added so that they can be dried into powder form. So generally in parenteral solution, same, you took water for injection, you heated it 120 degrees centigrade for 20 minutes, you cool down at 60 degrees, divided the water for injection into two parts. In other part, you added all the other remaining things, then you made up the volume, then you went for sterile filtration, then you went for filling, packing and sealing. But before going to the filling, packing and sealing, we'll go for the lyophilization. Then the dried product is filled, packed and sealed. So this is the third method of formulation or manufacturing of dry this thing parenterals. Okay, so this is about the preparation of small volume parenterals, guys. Then you can see some of the marketed small volume parenterals, right? In cartridge forms, ampules, vials and dry powders are also available on your screen. You can see. Coming to packing, packing is very important. Glass containers, plastic containers are generally used, right? Especially closures are made up of rubbers for multiple dosage drugs. Like vials, we use generally thermosetting and thermoplastic closures, right? Again, it was closed with, sealed with an aluminum foil, right? Aluminum cap. So this is the closures, and containers are generally